So, it's that time of year again, open enrollment for health insurance. I'm really dreading it.
I know, it can be overwhelming. There are so many plans and options to choose from.
Okay, so I could have a low deductible but still have to pay copays?
That's right. It's important to understand how both deductibles and copays work in your plan.
And then there's the whole network thing. I'm not sure I understand that.
Networks are groups of doctors and hospitals that your insurance company has contracted with. If you go outside of your network, you might have to pay more or even be denied coverage.
So, I need to make sure my doctor is in the network.
Yes, that's crucial. You should also check if your preferred hospital is in the network, especially for emergencies.
What about prescription drugs? How does that work with insurance?
Most plans have formularies, which are lists of covered drugs. They often categorize drugs into tiers, with different costs for each tier.
So, if my medication isn't on the formulary, I'm out of luck?
Not necessarily. You can often get prior authorization from your insurance company to cover a drug that's not on the formulary, but it's always good to check beforehand.
And it's not just about the price, right? There are all these other things to consider. And then there's coinsurance. What's that all about?
Coinsurance is a percentage of the cost you pay after you've met your deductible. It can vary by plan, and plans with lower premiums often have higher coinsurance.
So, if I have a high coinsurance, I could end up paying a lot even after meeting my deductible?
Yes, that's why it's important to understand the coinsurance percentage and how it could affect your out-of-pocket costs.
And finally, there's the out-of-pocket maximum. What does that mean?
The out-of-pocket maximum is the most you'll have to pay for covered medical expenses in a year. Once you reach that limit, your insurance will cover 100% of the costs.
That sounds like a good thing. But what if I reach the out-of-pocket maximum and then have another medical expense?
Unfortunately, your out-of-pocket maximum usually resets at the beginning of each year, so you'll have to start paying again.
This is all so complicated. I'm starting to feel overwhelmed.
I understand. It can be a lot to take in, but it's important to do your research and choose a plan that fits your needs and budget. Absolutely. You have to think about your needs and what kind of coverage you're looking for.
Maybe I should talk to an insurance broker or agent. They might be able to help me make sense of all this.
That's a great idea. They can help you compare plans and find one that's right for you.
Thanks for explaining all this to me. I feel a little less lost now.
You're welcome. I'm glad I could help. Remember, it's okay to ask questions and get help if you need it.
Like, what about deductibles? I've heard that can be a big deal.
It can be. A deductible is the amount you have to pay out of pocket before your insurance starts covering costs. Some plans have very low premiums, but then the deductible is really high.
So, if I have a high deductible, I could end up paying a lot before my insurance kicks in?
Exactly. You need to weigh the pros and cons. A lower premium might seem appealing, but if you have a lot of medical expenses, that high deductible could really hurt.
What about copays? Are those different from deductibles?
Yes, copays are fixed amounts you pay for specific services, like doctor visits or prescriptions. They don't count towards your deductible.